And what the heck is going on with Medicare for next year?
Medicare Open Enrollment for 2026 is not what you think. It's no longer a time when you simply went on Google or YouTube to compare to save money or have better benefits.
Yes, millions of people like you will be dropped from your plan, have fewer options when shopping, have more agents turn their backs on you, will have no option but to pay double or triple what you're paying now, or left stuck on the same plan for the following year.
And we feel your frustration. This isn't just affecting you, but thousands of our clients, including our own moms, are stressed.
And as agents, this is the most stressful year in 20 years in being in the business. Wouldn't you agree, Ann?
Yes. Whether you have a Medicare Advantage, a Medigap, also called a Medicare Supplement, or a standalone drug plan, we will show you what you can expect, how to avoid hours of stressful research, including those annoying telemarketers, and how to avoid making the wrong decision.
And if you want to be like our clients, including our moms, who were able to make stress-free decisions, make sure you watch until the end of the video because we're breaking down in today's video what's going to be crucial for you.
Let's start with the plans that are affected the most and then proceed to the least. We'll do a quick overview and then break them down one by one.
In 2026, the Medicare plans that will be affected the most are called Medicare Advantage plans, also known as Part C of Medicare.
The federal government funds these plans, allowing insurance companies to administer your care.
These plans only have a one-year contract with Medicare. Therefore, these plans can change annually, or the plan can actually opt out of Medicare.
If you are under one of these plans, you are no longer covered by original Medicare. You must follow the rules of your insurance company.
Now, if you're unsure whether you have a Medicare Advantage plan, simply look at your card. If it doesn't say the word supplement, then it's most likely an Advantage plan. Your card will most likely say somewhere on the top HMO or PPO or somewhere on the card.
The second plan that will be significantly affected are called standalone drug plans, also known as Medicare Part D. Since Part D started in 2006, 88% of companies will have dropped for 2026.
That's a lot. If you're on a Medigap or Medicare Supplement plan, we will discuss your massive rate increases in 2025 and guide you on what you should or should not do.
So, circling back to the Medicare Advantage plans, look out for your ANOC letter, which is your annual notice of change. This letter will tell you one of two things: how your overall costs and benefits will change, or if you will be dropped in 2026.
Many Medicare Advantage plans are also forcing you to switch from a PPO to an HMO plan, thus leaving Medicare completely out of your area.
Now, a PPO plan is a Preferred Provider Organization, PPO, which allows for more flexibility in choosing doctors outside of the network.
HMO plans generally do not offer out-of-network coverage and typically require a referral to see a specialist, except for the HMO POS plans.
Now, why is this happening? The previous administrations made massive cuts to Medicare, resulting in an unexpected rise in medical inflation, which has led to less than expected profit margins.
A special note was made by one of the largest insurance companies, United Health Group. Notice what they said.
Unfortunately, given these pressures, we have made the difficult decision to exit plans that currently serve over 600,000 members, primarily in less managed products such as PPO offerings. So over 2 million people on Medicare Advantage will be affected. Many plans that do not exist will likely increase their premiums and copays and perhaps cut some benefits.
Or they find out that the plan is no longer renewing for 2026. This means that if you're on a Medicare Advantage plan, review your ANOC letter. That's your annual notice of changes, to see how your costs might increase and how some of your benefits actually may decrease.
If your plan is not renewed, you will need to find a new one on your own. You will not be automatically enrolled in another plan. If you don't actively search for a new plan, you will have original Medicare A and B only, be stuck paying the hospital Part A deductible, and face the risk of paying 20% of any Part B medical expenses.
The biggest issue with paying the 20% is that there's no limit, or what's called a MOOP, a maximum out-of-pocket limit. So if you get cancer, for example, that's $1 million, you will have to pay $200,000 because there's no cap.
Also, you will not have a drug plan and will have to pay for all of your drug costs.
So what should you do to avoid hours of headaches in researching and understanding all the nuances of each plan?
We broke this down into two parts. The second part is often overlooked, and it's how most people get taken advantage of.
Let's first talk about using technology versus a real person.
Try to work with a good broker. This might take some time to find, but ask your friends or find a YouTuber who's a broker that you trust.
Now, we're not saying that you cannot figure this out yourself. Many of you, I'm sure, are smart enough to navigate through Medicare.gov or call the insurance company yourself or even use ChatGPT.
And if you're a do-it-yourself type of person, then go for it.
However, this segment is designed to save you time and help you avoid mistakes. Many people are unaware that there's no cost associated with working with a broker. A broker cannot charge you extra, and there's no additional premium that you must pay because you went with a broker.
We must discuss a big problem if you are being dropped from your plan and planning to switch to a Medicare Supplement Medigap plan. On the screen, you will see a list of states where the agent or broker is being compensated or not.
The insurance companies had to make this difficult decision, since many people who are dropped from the Medicare Advantage plan already have pre-existing conditions, and the Medigap insurance companies must accept them. That's called your guaranteed issue right, or GI.
This is stressful for everyone, as clients usually expect assistance from their agent. However, the agent may or may not be able to leverage their 7.5 weeks to help everyone, especially on cases for which they don't get paid.
That's why the insurance companies are also not paying, because they're not making enough money. Therefore, they cannot leverage to pay the brokers. So each agent or broker would decide how to approach this. Here at KCIIS, if you're our existing client, we will continue to assist you with enrollment or provide guidance.
Now keep in mind that Medigap premiums will typically range from $150 to $250 on average, which could be double or triple what you are paying now.
And in some cases, some of you are paying zero. That's 100 to 200% increase of what you're paying.
Yikes.
So what about enrolling in another Medicare Advantage plan? Well, many insurance companies attempt to eliminate brokers to save money. However, be aware that if you work directly with an agent from the insurance company, they will only shop for plans that they represent.
Calling the insurance companies directly will cost you hours, if not days, of comparison, because each company will not compare its own plans with those of other companies.
Brokers, on the other hand, will be able to shop for multiple plans on your behalf and explain the differences to you.
And even though you can visit Medicare.gov and see it for yourself, these brokers are licensed with the carriers and may have more information behind the scenes that you cannot see online. Things such as how long they've been in your area, the customer service experience, whether that company has a reputation where it's challenging to find new doctors accepting that plan, and so forth.
So the broker's job is to save you countless of hours trying to read between the lines and compare all the jargon that you're not familiar with.
Also, be careful of all the telemarketers that will be calling you. These will be either directly from the carrier or from large call centers that spend millions to purchase a list of all those affected.
If you enroll with them or the carrier directly, please note that your current agent will no longer be able to assist or discuss your plan with you. Many have accidentally switched plans thinking the agent or broker will still be the agent of record.
Yeah, it's better to call your current broker or friend. You'll receive more personalized service and won't be bounced around to different agents, unlike working with a carrier directly or these large call centers.
Now, here's another key factor. Some of these plans no longer pay commissions to the agent or broker as well.
Yes, this could affect your choices. So make sure your agent is being completely transparent with you and not pitching what they want to sell you.
If you're not satisfied with your agent, please don't hesitate to contact us.
Someone in our office or our partners will be happy to assist you. We represent over 50 plans and can help shop in all 50 states.
So what's the best practice to avoid making a mistake and choosing the wrong plan? To avoid wasting hours of your precious time, make sure that you look beyond the cost. If you're incredibly healthy and costs are the most important thing to you, sure, then that's where you start.
However, if you're worried about getting sick or are already undergoing treatment, you would want to first find out if your doctors, hospitals, and medications are on that list.
All marketing materials begin with benefits and costs rather than a network of doctors and hospitals. And that's the first trap that people fall into when looking online or if they receive a phone call from a telemarketer.
It's like buying wine in a fancy bottle at a low price. Once you drink it, it tastes nasty and you feel like you just wasted your money.
I feel like we just did that recently. So make sure the hospitals and providers you want are on the plan first, then dive deeper into the costs and benefits.
Regardless of who you work with, be patient and expect longer than usual hold times or a delay in your agent's response. We all have only 7.5 weeks to help everyone.
And CPAs have at least 4.5 months to help everyone. And they can even still file an extension until October, November?
Yes, so please be friendly and reasonable with your agents. It's best practice not to wait until the last week to ask for help either.
If you do, expect to have a rushed call or more potential mistakes to happen.
Just like giving your taxes to your CPA the very last week.
Exactly. In 2026, there's a massive 90% decline in the number of plans participating in Medicare Part D drug plans since their inception in 2006.
Keep in mind that Medicare itself does not offer drug plans. The federal government funds the insurance company, like the Medicare Advantage plans, allowing insurance companies to administer your care.
Part D plans have also faced similar pressure and had to exit Medicare. These plans, like Medicare Advantage plans, have a one-year contract with Medicare and can change yearly or opt out of Medicare.
To give you an idea of the magnitude of companies leaving Part D back in 2007, there were over 50 companies, with each company typically offering 2 to 3 plans. In 2024, the number of companies dropped from 50 to only 7.
In 2026, only 5 national companies, with some areas having 6, such as California, because we have this regional plan like Blue Shield of California. But that's really a massive 88% decrease in plans participating in Part D plans, Anne.
In addition to the plans dropping out, many drug plans are no longer paying your broker or agent. Expect many agents to turn their backs on you, saying they can no longer help you with your Part D plan.
Unfortunately, this is a harsh reality, but put yourself in the shoes of the agent for a minute. They have 7.5 weeks to help everyone. If they're assisting everyone on their Part D drug plans and they're not being compensated, they may not be able to keep their business running and keep the lights on.
So what should you do? Well, here's the good news. Comparing drug plans is not as difficult as comparing Medicare Advantage plans. You're not dealing with as many moving parts.
For the drug plans, you mainly care about the following. Are the drugs covered? What is your deductible? Medicare's 2026 default drug plan deductible is $615. Some plans will cover the deductible while others require you to pay for it. What tier or levels are your drugs on, which affects your copays?
Are there any restrictions, such as prior authorizations or step therapy? By the way, the out-of-pocket maximum for covered drugs for 2026 is set at $2,100. So that's the most you would pay for your covered drugs.
Now be careful of the agents who only show you the plans that they get paid for. Of the 5 or 6 companies in most states, only 2 to 3 companies will be paying your agent or broker.
We sympathize with the limited choices available now, and we hope you can also sympathize with your agents.
And due to the stress that both the clients and brokers like us have to endure, we have included all Part D plans available in your area in our Part D comparison tool.
Our Part D comparison tool pulls all the information from Medicare.gov. However, the difference is that if you enroll in the drug plan we are compensated for, we can also provide support to you.
So you can either use our Part D comparison tool or go to Medicare.gov.
Yes, we want what's best for you.
Now let's talk about those of you with a Medicare Supplement, also known as a Medigap plan, and what you can expect to happen during your 2026 Medicare Open Enrollment.
In 2025, Medigap Plan G experienced an average increase of 13%, with more plans rising by 60% or more.
That's huge. Again, Medigap plans are also known as Medicare Supplement plans, and these plans are not funded by the government like Medicare Advantage and Part D drug plans. These plans in most states are standardized. What that means is they cannot change the benefits from year to year.
Therefore, Medigap supplement plans do not fall under the annual Medicare Open Enrollment. You cannot switch your supplement plan to another carrier without being underwritten, which means you will need to answer a list of health questions and be accepted by the plan.
On the screen, you will see that some states have an open enrollment every year for the Medigap plans, while other states you can switch your plans throughout the year.
So if you're considering switching your Medigap plan, what should you do?
First, know the rules. If you switch to another Medigap plan, you will be subject to underwriting, except for the states we already showed.
If you switch to a Medicare Advantage plan, note that you will not be able to return to Medigap plan without undergoing underwriting, except in the states already mentioned.
So please be careful of the telemarketers or agents who are eager to switch you from your Medigap to a Medicare Advantage plan.
Many seniors who loved their Medigap plan later regretted switching and found they couldn't switch back.
In addition to the states that we showed you, Medigap Open Enrollment is a one-time only opportunity. Either 6 months from turning 65 or 6 months from when you are new to Part B. Now, with some exceptions, and those are also guarantee issue, called leaving employer plan and so forth.
So, how can you avoid making a mistake during the 2026 Medicare Open Enrollment?
Well, here are a few key reminders. First, read your ANOC. If you don't have one by October 15th, then call your insurance company immediately.
Understand the rules for changing. We also made a video that discusses each rule for each plan in detail.
Understand the differences between a Medicare Advantage and a Medigap plan. We made a video that discusses the conceptual and cost differences between the two. This video dives deep, comparing them side by side to show you why one would choose a Medicare Advantage plan over a Medicare Supplement plan.
We also introduced in our past videos our two moms who made very different decisions, but are very happy with their decision.
And my mom made the best decision.
Okay, that's up for discussion. We will show you those videos in just a few seconds. Use your agent or broker if possible, or call us if you would like our support. Lastly, remember cost is essential for everyone. However, cost should be the last consideration unless you're so financially constrained that you have no choice.
Now, why do we say that? Money is of no use to you if you're not healthy and cannot get the care that you need.
This is why we encourage you to watch this video up here, where we compare the costs and also discuss reasons to choose a specific plan that go beyond the money.
This other video up here also discusses the rules for changing to give you confidence and avoid making the wrong move.
We wish you a stress-free 2026 Medicare Open Enrollment.